All right, so we're right at the noon hour, and I'm sure participants will be trickling in soon, but we've got a pretty awesome agenda for you for this hour, so I'm going to get started. Welcome, everyone, to part one of Health Promotion Ontario and Ontario Public Health Association's four-part webinar series. My name is Tanya Nagpal. I am a volunteer with Health Promotion Ontario and will be facilitating the webinar today. I'm joined by our planning committee. They have worked on preparing this series for you over the past few months. In lieu of an in-person Health Promotion Ontario conference this year, we have put together a very exciting webinar series in collaboration with Ontario Public Health Association. Although we would love to see you all in person, we are very happy that you can join us today via Zoom. Throughout the month of November, every Thursday at noon, we will be hosting a webinar addressing health promotion in a global pandemic. The amount of information surrounding the global pandemic, needless to say, is a lot. However, this webinar series aims to address novel topics and really focuses on the role of health promotion and health promoters from a variety of different sectors. And on that note, let's start the series with our kickoff webinar. Today's webinar includes 3 guest speakers who will be addressing the drastic changes we have experienced in our respective fields and will be sharing strategies with us to manage these changes. I will first begin by introducing our 3 panelists. Following this, each speaker will share a short presentation, and we will then have a Q&A session after each speaker for you to ask your questions. You can type your questions as they pop up. You will see at the bottom of your screen either the option to type in the Q&A section, or you can type in the chat. Our planning committee members are monitoring both, and they will be able to share with us your questions. And then I will then ask our speakers. We encourage you to ask all your questions at any point, and we will do our very best to answer as many as we can. Your mic and camera will be remained muted throughout the webinar. So on that note, it gives me great pleasure to introduce our panelists today. We have with us our Health Promotion Ontario Fearless Leader, Marty Mako. Marty is currently the commander of Mobile Integrated Health with Niagara Emergency Medical Services. Previously, Marty was a manager in the Chronic Disease and Injury Prevention Division of Niagara Region Public Health. Prior to that, he was a health promoter in Niagara for 12 years. He worked in chronic disease and injury prevention, and his portfolio included projects that addressed the social determinants of health, identifying and meeting the needs of priority populations. Marty will be discussing mobilizing communities in a pandemic. Our second panelist is Melanie Stone. Melanie is a PhD candidate in gender, sexuality, and women's studies at Western University. She is the accessibility specialist for the City of London and the vice president of Women's Para Hockey of Canada. She is also a single mother and a professor of disability studies and sociology at King's University College. In her own research, she examines the ways that mothers with disabilities navigate employment systems and supports in London, Ontario. She will be sharing with us work and research from home strategies. Finally, we have William Wang. William is a policy analyst in the Multilateral Relations Division with the Office of International Affairs for the Health Portfolio. William also co-founded Public Health Insight, a public health communication and knowledge translation organization. During the current COVID-19 pandemic, William has been supporting the whole of government response by collecting international intel and data on the changing public health measures and actions across like-minded countries. So I'm going to turn my mic off and turn it over to our panel, beginning with Marty. Thank you so much, everyone, and we hope you enjoy today's session.
Thank you, Tanya. I'm going to share my screen now. One moment and pull up my slides I'm going to be using for this bit of my presentation. How's it working, Tanya? My slides are being shown there.
You are good to go.
All right. Just before I get into my presentation, I just have one slide here on Health Promotion Ontario because I know we have some HPO members on the Zoom today, but we also have some non-members. So for those that might be less familiar with what is Health Promotion Ontario, we are the voice of those who are in the profession of health promotion across the province. We seek to advance the critical importance of health promotion and its practice through a number of ways. Professional development, and these webinars are one great example of how we do professional development since we can't have a face-to-face conference this year. Membership, communication, and advocacy. We've been a constituent society of the Ontario Public Health Association, and we've been active since 1987. So some of you will remember the Ottawa Charter was formed in 1986, so we started 1 year after that. We have dedicated health professionals from a variety of disciplines, so we really value being multidisciplinary. We have members from public health units, community health centers, universities and academia, and various other health-oriented organizations. And we are the founding chapter of Health Promotion Canada, our national organization, and we align with the vision, mission, and values of Health Promotion Canada. If you have any other questions about Health Promotion Ontario, feel free to connect with me afterwards. Happy to answer any questions you might have. All right, so getting into my talk for the next 7 minutes or so, I titled it Practicing Effective Health Promotion in a Global Pandemic. Whoops, let me go back one. 5 things I've learned so far. So we've all learned a lot trying to advance health promotion work over the past 7 months during COVID-19. I don't pretend to have all the answers. I'm speaking from a public health background in terms of where I practiced health promotion. So these are just some things that I reflected on and I'd like to share with you this afternoon. The meme on the screen there, I just thought was some humor to get us started, because we know even when we use those words health promotion, depending on who we're talking to, we probably get different answers in terms of what our family thinks we do, what our friends think we do, you know, and what our colleagues think we do. So I thought that was a funny way to get us started. The first thing I'd like to talk about is just from a leadership perspective, being a manager in the Chronic Disease and Injury Prevention Division when the pandemic struck. One thing I wanted to share is that it is important to identify and meet the needs of the staff who are doing this important work. It doesn't impact everyone in the same way. We all experienced COVID and trying to keep working in different ways depending on the phase of life we're in, the families we have, you know, the structures of our home life, because now having to work remotely and work from home became crucial to this work. So just a few principles I found that were helpful for me, and maybe they'll be helpful for you too. In terms of work from home, we use this language a lot. We are at home, but it is still a crisis, a global crisis, and we're trying our best to work. So having sort of that empathy and compassion for everyone who is trying their best. You really got to value your own personal, physical, mental, and emotional health as well. And that was more important than anything, especially in the first few months. You're trying to do your job the best you can, but we're all human, and we're all trying to really value our own health as well as the health of the communities we're trying to serve. I found a lot of people working from home were almost working longer hours because it wasn't such a separation of work from home. Your work was your home. So not trying to overcompensate for that productivity loss by working longer hours. You still gotta really have your personal time to really value and protect your own health. Be kind to yourself. It's not about judgment, about others trying to work harder than you or working as hard in different ways. Be kind to yourself and not judging how you're coping, and at the same time, not how you see others coping. I thought that was an important lesson to share. And finally, about success and what does success look like when you're doing health promotion work during the pandemic? It will not be measured in the same way as when things were normal. So trying to benchmark and compare your work now to what work looked like previously doesn't make sense. So those were just some lessons that I reflected on in terms of from a leadership role, what health promotion work looks like now compared to what it looked like before. Secondly, I really feel we have to strengthen our social networks to support the vulnerable communities that we're trying to serve. We know social isolation is a key social determinant of health, and those traditional support networks that we've had with friends and family, they've been broken during COVID-19. So we need to think more intentionally about how do we focus on isolated seniors who are at risk, and how do we keep them connected? Because we know relying just on altruism and volunteering, it's not consistent from community to community. So we need more system-wide solutions because it is so important to provide that link between the people who are most impacted by COVID and the health and social services they need. Seniors are just one example of that. Number 3, so this is about how we do the work. I believe we have to support innovation and creativity during this time, in addition to obviously following evidence and best practices, which has always been core to health promotion work. evidence of what works in terms of health promotion during this global pandemic, it's either weak, contradictory, or non-existent, because we're building that evidence base right now. And often we have to use our experience as a guide. We have to be innovative, creative. We have to try new things, try new approaches. And the best advice I have is to use a combination of the most available scientific evidence we have and a professional consensus of what works. In Niagara, we have a volunteer program called the Community Food Advisors, who do health education presentations in the community. Traditionally, those have been face-to-face presentations at workplaces and community groups. They had to shift their method of delivery, and now they do Zoom presentations. They had to develop these presentations from scratch because they were very different from what they'd done in the past. But kudos to those volunteers. They kept their same goal in mind of trying to promote healthy eating and trying to educate, but how they did it had to change. So having that flexibility in terms of your approach, I think, is key during the pandemic. I think we have to better address non-COVID health promotion issues. I mean, this might be a teaser, a trailer for the other webinar we have coming up on the shadow pandemic, but yeah, just quickly, we know that health promotion policies and programs have to be a priority during the pandemic to support physical, mental, and spiritual lifestyles. These priority areas, in my opinion, should include healthy eating and physical activity, mental health, substance use, early childhood development. I know there's others. Those are the ones closest to me from a public health background. Also, ongoing prevention programs such as childhood vaccinations, services to cope with domestic violence, those need to be maintained as well. I know these topics aren't getting the headlines right now because it seems like COVID is the #1 headline each and every day, but we know these health issues are still major priorities and need to be addressed from a health promotion perspective, even if they're not getting the front page news. Because the risk of morbidity and mortality due to these non-pandemic issues, they will be significantly higher than those directly related to COVID-19. And in Niagara, we're lucky we have a medical officer of health who really supports this and has protected our chronic disease and injury prevention division. We have not been redeployed into the COVID work. We've still been given the permission to keep working on non-COVID issues. And finally, the last one I wanted to share is that we must find ways to engage the communities we're trying to serve. I know this is much harder during the pandemic when we have less of those face-to-face opportunities, but the communities with lived experience, they have to be an integral part of our health promotion response during COVID, both including them during the COVID pandemic and with any exit strategy as we're coming towards the end. What does that look like? That will need to change. But it would reduce the resistance to the change measures that we're proposing and that governments are trying to impose on the public, and because by involving them in the process, you're more likely to get their buy-in. Plus, it will help to maintain those prevention measures after the pandemic. One example I wanted to share for this point, we have a network called the Lived Experience Advisory Network. So public health, we started this network of folks with lived experience, often facing poverty, struggles with affordable housing. We met with them monthly in the past to get their feedback on new public health initiatives we were forming and on policy ideas as well. We've shifted this meeting format from face-to-face to virtual. We've shifted the frequency and also the start-finish times because they're now all participating from home during the pandemic. But the key was the network members wanted to keep it going. So they didn't want it to stop. They said, maybe we have to change the timing, the frequency, the format, but they still wanted to give their feedback. And it was our job as public health and health promotion practitioners to keep it going. So, you know, having that flexibility and also keeping the people we're trying to serve at the heart of any program or policy, I think is crucial even during the pandemic. So those were my 5 lessons learned so far for how to do effective health promotion and community mobilization work during the pandemic. From my perspective, I'm probably going to keep learning, and I'm sure we all will as the months and tick by, but I'm happy to answer any questions from the group on this work or anything else about my role. Tanya, I guess I'll hand it back over to you.
Yeah. Thank you so much, Marty, and thank you so much for kickstarting this webinar series with an awesome presentation. So we do have a few questions, but please, to all of our attendees, feel free to write in the chat at any point, and I will try my best to get through as many as we can. The first question that really came multiple times is whether these slides will be made available, and these tips are very helpful. And so to all attendees, we will be posting the webinars on our HPO website. And so you will be able to access the presentation as well as the slides. And a few of our planning committee members have also been answering more specific questions regarding to availability of slides within the chat. So Marty, the first question we have for you, what are some hidden challenges with mobilizing communities during a pandemic that perhaps we don't necessarily get to know from the news, but as a health promoter, what are some hidden challenges?
One I'll say is that a lot of health promotion work is done in partnership and collaboration. And a challenge that maybe wasn't as visible was that if you're trying to move important work forward during the pandemic, it's tough when your partners who you typically would work with, they're also struggling. So they may have had some of their programming put on hold. Maybe they've been redeployed into different types of work. Some of their staff may have even been laid off and might not be working at all. So, we try in health promotion to work in this collective impact approach where we're not the lone soldier, we're working together with our partners, but that's tough. It's tough when the partners you would typically work with, their work life and model has totally changed as well. So trying to stay engaged with stakeholders and partners that's life has been turned upside down for them, just like it has for us. So that's something that we found was challenging. Another hidden challenge might be that just that the like I said, the diversity of challenges faced by your team, that some people might be doing really well working from home and trying to find that new life and new balance. Others might be really struggling. So, when you're working together, even within your team environment, so that's maybe that lesson on the first slide about being kind, being patient, not always knowing what your teammates, when you see them in the office, you're all in the same location, you're all working together. But when everyone's at home, it's just totally different. So from a leadership manager perspective, you can't have a one size fits all approach. You really have to take the time to understand how everyone's doing and do those regular check-ins, not just check-ins about how the work's going, but how are you doing? Because if someone's not doing well personally, that will affect their work.
Amazing, thank you. And I think our next panelist will speak more to this as well. The next question we have for you are, what are some strategies that people have been using to engage vulnerable populations during COVID? We have attendees who have said that this is a population that they may have worked with, and many people don't have access to something like the internet where we get a lot of our information.
This was a struggle for us too, because we did have a number of staff in my division titled community health brokers who did work right in our social housing and our subsidized housing communities, and they would do face-to-face activities in a community house, like community dinners, chat cafes, like those sorts of initiatives, which is based on social gathering, right? And this was really tough. So the slide that's on the screen right now is one of our attempts to keep that going virtually. Your point is well taken that not everyone has access to the internet, but we tried our best to connect with people in different ways. Virtual, it did work for more people than we thought. We sometimes think not everyone has internet access, but even in some of these low-income communities, we were able to make it work. You will have tech glitches. So with that said, it's being patient because some people's Wi-Fi cuts in and out, the sound and the visual goes in and out. Not everyone has the same internet strength at home when you try and do this type of engagement, not face-to-face, but virtual. But I would say go into it with the assumption it might work. I think virtual is the way that we're having to do a lot of this. I know some use the phone as well and do kind of group phone discussions if internet isn't an option, especially with seniors. They might not be as comfortable with the online, so maybe it's using the phone, old school teleconference as an option. But I would say committing to this is one of my 5 lessons for a reason, that you need to engage the communities you're trying to serve with any health promotion work.
Okay, and actually we have 2 more questions related to sort of the virtual and online world. Has there been any best practice on privacy protections consistent with health guidelines when using Zoom? So do you know of any policies or any established policies related to using video or not necessarily audio when interacting with communities?
Yeah, when we first started, I think Zoom had a tech glitch where it wasn't it was letting people Zoom bomb. I think that's the right word. And you weren't keeping it password protected. I think over time, we've learned there are security measures within Zoom that you can take in order to block people from just popping into your Zoom meetings. So having each meeting having password protection and like codes to type in before you get in, we've tried to use those more often and make that more of core of it. But also, yes, it's always an option whether or not you have the video feature on and off. You talk about video and audio. You can use the audio only feature and have a black screen if you're not comfortable. And I think that's another, part about not having a one size fits all. Some people might be comfortable displaying their faces on these sort of meetings. Some might not. And we don't have pressure either way. If some people want to be audio only, that's totally fine. If some people want to show their background or their wall or whatever behind them, that's fine too.
That's awesome. And we have time for just one more question. On a broad level, how would you say cultural sensitivity and competence play a role in health promotion and program building?
I think we're trying to get better at this. In terms of cultural competence, we've tried to do better from an Indigenous perspective in terms of learning about health promotion through an Indigenous lens. I think learning is where we're at right now in terms of cultural competence, even thinking it through an health equity lens and how we work with vulnerable groups from social housing backgrounds and low income and living on folks with disabilities. There's so many different lenses you could look at that through in terms of what you mean by culture and social determinants of health. But I think we're committed more now to not just the knowing that affects health outcomes, but what are we doing about it? So trying to embed that health equity lens in practice so our staff have cultural competence when they're developing programs and implementing evaluation plans to know how we're benefiting people. So yeah, I found like earlier in my health promotion career, we talked about it a lot. It was sort of the knowledge and awareness level. Now I think we're trying to get better at implementation and how do we embed these concepts into health promotion practice. It's not easy, but I think we're trying to get better at that.
Amazing. Thank you so much, Marty. And if I can ask you, I'm going to move forward to our next speaker, but you do have a few questions that have been sent to you in the Q&A at the bottom of your screen. So if you can respond via typing, and then perhaps if you are willing to provide an email that they can contact you. You mentioned that earlier in your presentation, but there are some questions for you in the Q&A.
Sure.
So thank you so much, Marty.
Should I stop screen sharing now?
Yes, please. All right, and we are going to turn it over to Melanie Stone.
All right, so hello everyone. My name is Melanie Stone, and I'm going to talk about a few things we can do to be a little more real. I always feel like when I come up to these public health events, I feel like someone accidentally invited their angry aunt, because that's how I'm going to sound throughout this presentation, but go with it. I hope you will learn something. So just a note about myself. I actually live in student housing while I'm finishing my PhD. A family of 7 lives on one side, a family of 5 lives on the other. My house is never quiet, not ever. I work full-time, and I'm a full-time solo mom to a 12-year-old. My daughter was born during my first master's, and so I've only ever been a student parent. She's actually not known me in any other capacity. So a lot of the tips and tricks I'm going to talk to you a little bit about are for students that have a bit of a less conventional path. I say that I'm a volunteer, sort of a frequent volunteer and a director at Women's Para Hockey of Canada, and I work full-time as an accessibility specialist. I'm also in the home stretch of my PhD, so that means I'm usually quite tired. My job, I like to joke, is sort of the Leslie Knope of accessibility for the City of London, so I get yelled at a lot, but I love my job. I love accessibility, and I hope that will come across in this presentation. So I'm going to talk about just a few things that we can do to make it better for everyone, to make our lives a little more inclusive and our programming more inclusive. One is to avoid toxic positivity, get out of your program in school, accept interruption and chaos, ask who is this for, learn to write in strange places, and it's okay to love and hate all of this at the same time. So the first thing that I've really learned to acknowledge is toxic positivity. And this was something I couldn't put my finger on until recently. I think we've seen a ton of this lately, especially as, we've seen the very images of people's backdrops and Star Trek images and all sorts of things as we're all, everyone's fine, everything is fine. But I really like this definition. It's simply the relentless focus to concentrate only on the good at the cost of ignoring all of the bad. And it's the erasure of negativity from your life via social media, from your conversations, and from your expectations of conversing with others. So the expectation that everything's fine all the time. And it forces unnatural and unnecessary engagement with the positive. It's also deeply inauthentic. And so as somebody who has been a non-conventional student for a really long time, it is okay to have a variety of emotions and feelings all at the same time. Only you know what works best for you, and you need to find out what keeps you going in grad school. Reach out if you need help, and if you don't have a support system, try to build one. I know for me, it was reaching out to other parents with young children when I was going through my early stages, and my child was in kindergarten, and there was no quiet time. There was no babysitting. We didn't have extra money for just about anything. And I think that avoiding toxic positivity and having a good laugh about how terrible things are is actually a really important thing to do. So find those moments to do that. Another really big piece of advice I have is to get the heck out of your program, right? I mean it. And I mean, not just get out and do something to check a box on your CV, but really just go do something that makes you a little uncomfortable, where you're going to meet people that have nothing to do with this interest of yours. And I think that that's so important to keep you grounded and keep you aware of what's happening in the world. And also just make friends that have different dreams than you, right? Because I think we get wrapped up in our own ideas of what works and what doesn't a lot. And it can be very self-serving, and it can also get really competitive. It's always really important to remind yourself that there's a bigger, better world out there. I love this slide, but you are absolutely special, but so is everyone. And a master's or PhD or bachelor's is a great accomplishment. It really is. But so is compassion, learning to laugh at yourself, making a friend, being empathetic and kind, and learning from failure. We all have our own reasons for pursuing a PhD or master's or bachelor's, wherever you're at. They're not all noble, right? And I think it's really important to recognize that this is just one thing you're going to be doing with your life. It's not the only thing you're going to be doing with your life. Accept interruption. I work with people with disabilities every single day, and I have learned so much about how willing people are to adapt to different changes. Just imagine the number of barriers that have gone up, the plexiglass that divides us. People who are hard of hearing have had their mouths covered. We have really built a lot of barriers that are so necessary in order to keep us safe and well, but we have to find ways around those barriers by acknowledging that they exist and looking at them every day and say, okay, what can we do? Can we add a microphone? Can we work with an Ubi Duo machine? Can we work with all sorts of technology to assist people and make it okay for people to ask for what they need? Make it okay for people to bring their lives fully into their meetings. I don't think I've ever had a Zoom meeting at my home where my child hasn't popped in trying to find the yogurt or her socks, right? That has to be okay. My job is not to prevent that anymore. My job is actually to teach other people that this is how my life is, that interruption is how we live, and we will be better off when we absorb it and promote that. I ask this question of all my colleagues, and so I want you to practice this one because I think it's really important, whether you are a health promoter and you're creating a new program, or someone is sharing something with you and you have to ask a critical question. Ask, who is this for? I find that a lot of health tips and tricks are crafted by and for reasonably wealthy people. And I consider time wealth really important there as well. So people who have time in their day to, do some interesting things. As a result, I've learned to ask myself, who are these people speaking to? Because they may not be speaking to me. And therefore, when I do a program, when I'm developing a program, I ask, who is this actually for? And I try to change up my expectations and make it more accessible and inclusive. A few years ago, there was a newsletter that went out at our university, and it said, to get your steps in, go take a walk to a bathroom that's not in your building, right? This went to all staff, not just professors, but only professors can really afford to take a 25-minute pee break to go to the bathroom in the library, right? So that's not a very appropriate suggestion for everybody. And I think it's really important to ask, like, who is this for? There was a suggestion that, while you're doing your laundry, you do squats, right, to get those steps in, to get that exercise. Well, I have to use a laundromat, right? So my steps are already, on the bus, going to, lugging my laundry. There was also very helpful imaginary commutes. We're all supposed to get into our cars with our coffee and sit there for a little while, pretending we're driving, and then get out and go into home and set up our space. That may indeed work for somebody, but my daughter is going to wonder what the heck I'm doing sitting in the car. And my neighbors are going to wonder what's going on. And so this isn't helpful for everyone. So just start to think about, who are we promoting to and how are we accepting that information? Biggest thing I've learned is how to write in strange places. Your noise canceling headphones help for this, but most of my thesis has been written on my lap in the car while waiting for my child to finish dance lessons. Don't wait for a beautiful week-long stretch of writing time. That's not going to happen, especially in COVID. It just doesn't exist for most of us. So write and study in bursts of time and try to fit those bursts into your life. You can do it this way. And it's okay to enjoy this. I don't know how many times people told me that doing a PhD was the hardest thing that anyone would ever do. They haven't actually been a roofer or a miner or done any farming work or any of those things. They just we would focus on how awful it is, how drudging it is, what have you. But when you actually talk to people with other jobs, you realize that every job is difficult, right? Every job has its difficulty. We need to be able to enjoy this. Otherwise, there is no point in doing a PhD or a master's. You need to be able to have a good laugh. You need to be able to enjoy part of it. I liked my time in grad school. I liked listening to presentations and going to classes. I liked the time it afforded me. Balance is everything, and being happy at some points is so important. Finally, we need to remember what's important in life. Friends, waffles work, or waffles, friends work, doesn't matter, but work is third. So I share this because I am, as you can probably tell, just somebody who works a lot, and I love work. I love what I do. I think accessibility is so much a part of my life and my learning. I'm so lucky. I'm not sure what happened. But sorry, something happened on my computer. But what I am really excited about is just sharing, my tips and tricks for from people with disabilities with you, which is making that space for interruption, making sure you're aware of how, how you're promoting and for who you're promoting, and just being aware that we are all in this, but we are not in this together. We are in very different boats. We are with very different equipment, and so we need to be very conscious of that as we go forward. And that's it. Thank you so much.
All right. Thank you so much, Mel. So we're going to move into our Q&A. So just a reminder, please type in your questions in the chat or in the Q&A section, and we will get right to them. So a question that came right when you started: how are you getting the closed captioning on your presentation? This is a huge accessibility factor that I am loving with your talk.
Yes, so this is actually a Zoom option and a PowerPoint option. So you can actually change it right in your PowerPoint presentation, so that whenever you enter into presentation mode, there's a little closed captioning button that you can click. And I do it for everything now. There's also a function in Zoom and in Microsoft Teams. So all of these have that. Just a note that it is auto captioning. Oftentimes folks in the deaf community call this craptioning. So if somebody requests it, make sure that you have a legitimate transcription service to do it, because there are some issues related to clarity. And if somebody, it's a helpful thing if nobody has requested it, but if somebody needs that CART services, you're going to want to go the extra mile and make sure that that's accommodated.
Perfect, thank you. So the next question we have for you is, given that your work life, home life, and research life is now in the same place, how are you navigating all of these roles in the same place? And what are your strategies to do that?
Yeah, so I have been better lately at kind of carving out time in my day, so that, between this time and this time, I'm working on my thesis. Between this time and this time, I'm working at work and not taking those extra calls. Unfortunately, there's not really a schedule for my daughter. She doesn't stick to that. So I do have to allow for lots of interruptions and bumps in the road there. But one of the things I've just learned to do is not be precious about where I write or where I work, and just figure it out as I go. And just keep checking in with myself about where am I at? Am I doing, last week I had a really bad week. It was just too much. So I had to take a step back this week and say, okay, this week I'm going to carve out a couple of days where I don't have any meetings, right? And I need to catch up on work. So just being constantly checking in with yourself is so important.
Mm-hmm. And now a question specifically for your student world. How do you suggest students deal with the feeling inadequate? How do you suggest students deal with feeling inadequate compared to their peers or other researchers?
Yeah, I think that everybody feels that way, even if they're pretending. So that, first of all, know that. I also think there's many different ways to be a student. I like to joke, and it is a joke, but that I was never the brightest in my class, right? Like I always knew that and I embraced it. And man, I was a worker. Like I could work like nobody could work, right? And so you bring your own perspective to that, right? So some people are just exceptionally good at presentation. Some people are exceptionally good at, you know, spontaneously coming up with answers in class. I am neither of those things, but I have other attributes. So cling to those, like find your way and use your own gifts to navigate yourself through the program. It's so important you don't compare yourself to others. I mean, I was nursing a baby in most of my classes and dealing, you know, I barely looked human at that point. So I was far from the ideal student, but I was there. And I think showing up is 99% of it.
And what is an ideal student, right?
Exactly.
So the next question we have for you is, can you give some examples of other big or small actions that increase accessibility during COVID specifically?
Yeah, so a really great tip and trick is to download an app on your phone that does text to or voice to text. And while you are talking to somebody, hold it next to your mouth while you're wearing a mask because they can see it printed out as you talk. It's been a huge help for our screeners, our health screeners at all of our events, anything that we're hosting in the community. You can hold that up and have it, you know, just like this captioning is being done right across your phone. That's a huge one. Also, there are a lot of technologies that the different nonprofits can have you try. Like one of the things we're using a lot is a T-loop system. So, you know, we put up plexiglass everywhere, but now we have to make sure people who are hard of hearing and use hearing aids can hear us acceptably, and our employees as well. So putting these types of technologies are so important. And I have just reached out to all of the nonprofits and to ask what's best practice right now. And a lot of the answer is just, we don't know, but let's work together, right? We're just trying to figure this all out.
Okay, thank you. For your research, I know you're coming towards the end of your PhD, but maybe you know from other experiences as well. What methods have you used to adapt your ongoing research to a socially distanced world, or what could others do?
Yeah, so I work with mothers with disabilities. I was very much in person. We did photo voice workshops together. So we did participatory action research, and our last one had to go online because of COVID. And this is an area that I think ethics needs to understand better. So I do think our ethics departments need to figure out how to do, because our kids are at home. And is it okay to have a conversation about how tough it is having kids with your kids in the house? Right. These are the ethical questions. So the women in my study alternated between their cars or outside porches or like hiding behind a curtain, like while their kids are in the other room trying to complete this research. It was just an adventure. But the best piece of advice I have to you is, like, you can do this remotely, but don't lose the humanity in it, right? So acknowledge those interruptions. That's part of the research. Like, what are you doing? What do you need? Know that it may take longer. So it may be just unideal. Perhaps somebody needs to have, you know, a bathroom break or a personal support worker in to help with bathrooming. You need to accommodate that. So just, you know that this is going to just take longer than those in-person visits. And you have to be attuned to what's going on around that person in a different way than if you're sitting with them, right?
Mm-hmm.
So I think we have some work to do in this area, but it worked. My final interviews were virtual. My first ones weren't. My 3 first photo voice workshops were all in person, and then my last one was online. We got it done. Was it perfect? No, but we got it done.
Amazing. And Mel, we have one more question for you, and we've got about a minute to get it answered, but I'd like to get that one in. So your tips are very reasonable and down to earth. How do you deal with people in power who won't accept interruptions as normal, but instead as unprofessional?
Yeah, we have the Human Rights Code. So that's how I deal with that. And family status is a protected ground. And so it's very important to remind people of this. You know, I think Marty said it a great thing earlier. We are not working at home, we're living at work. And we need to be accommodated. I'm lucky, I'm well-versed in the language of human rights and AODA and accommodations, but that's how I look at this. It's not a discussion, it's not up for grabs. It's like, and if you need an advocate, you need to find an advocate, and I can certainly help you. Provide some of my contact at the end to help you navigate that.
Amazing. Thank you so much. And again, to all our attendees, if you have more questions for Melanie, feel free to put them in the chat and Melanie can take a look at that as well. And so thank you again. And we're going to turn it over to our third speaker. So I'll just ask Melanie if you could stop sharing, and Next, we have William Wang telling us about his transition from grad school to work in a pandemic.
Awesome. Well, thank you, everyone. And I hope everyone's having a wonderful Thursday. I want to start off by saying what an honor it is to be invited to be able to speak here and kind of share a bit about my experience making that transition from grad school now into full-time working. Just before I start, I just want to make a small disclaimer that everything I do say today, they are my own opinions and my own perspectives and do not represent anything or any of the perspectives from the government of Canada. I think if we want to look back and kind of see how I made this transition, we would need to just take a trip down memory lane and see how I kind of got into the field of public health. Because I guess, as mentioned earlier during my introduction, I do currently work as a policy analyst at the Public Health Agency in the Office of International Affairs. And our office essentially is, it's an interesting middle ground kind of looking at global health policy and governance, as well as kind of managing a bit of the international relations and foreign service side of things. And I want to say that, I kind of came to this position mostly because, in undergrad, I do have a background in social science. So I have my undergrad in anthropology and geography. And this social science lens really kind of propelled me to explore health from a broader lens and looking at what social aspects kind of play into the role of determining population health. And it's thanks to a number of wonderful mentors back in my time as a student, providing me with opportunities to volunteer, participate in some of their research and working on things like One Health approaches in sub-Saharan Africa, things like looking at the intersection of public health and kind of environmental determinants of health and all those interesting things that kind of led me to pursue my master's of public health. And I decided to do my MPH at the University of Western Ontario, mostly because their program was very much focused on health and public health from a social determinants lens. Unlike some of the other programs which had a heavy science focus, I feel like, because I do come from social science background, I didn't really have that hard science experience to kind of go into the epidemiology and stuff like that, the more I guess hard science things, so I ended up going into the program Western. And it's very interesting because the program really provided me with some key soft skills, like interpersonal communication, group work, things like that, as well as very solid practice in writing and other technical skills that when I kind of combine everything together, it really helped me when I was doing my practicum last summer at the Public Health Agency. And it was an interesting time because at that time, this was, I want to say, May of 2018. None of us would have been able to predict that in a bit over a year, or no, sorry, practicum was in 2019, and none of us would have been able to predict that in over a year. The world would have been kind of put on standstill. But I think it's interesting because I think as I've started to work and move out, I guess finish my time as a student, I've been able to realize that oftentimes what you study versus what you actually work on in the real world are two very different things, and it's really comes down to how you kind of sell yourself and what skills you're able to kind of share with your hiring managers or supervisors to almost make yourself stand out amongst a group of other interested candidates. So when I was doing my practicum, it was interesting because I was working on a strategic foresight activity, kind of looking at how do we implement this new initiative into the office. And coming fresh off my MPH experience, I incorporated a lot of health promotion, theories of behavioral change, things like that into my program plan. And I think this was very beneficial because, for a lot of the individuals who were looking over my plan, my supervisor included, they didn't really expect this public health angle. They were looking at it mostly from a programmatic implementation side or from a kind of organizational change lens. But having I guess this new angle was very interesting, and I think it's really showed that even if you don't have any, like for me, I didn't have any organizational change background, but I was able to kind of bring in what I did know and what I did have from the public health lens to kind of help me in this role. I kind of want to end off with a couple of lessons that I've been learning throughout 2020, in terms of how the pandemic has affected me, and how, I want to say these are kind of pros in, in this time of uncertainty, being able to find kind of some pieces of positivity that I've been able to look at. So number one, I want to say that, the general public has had a heightened interest in the field of public health. Although it's not in the best of circumstances, I think there are positive to be seen in our field growing, and it's being prioritized by policymakers. And I think this eventually can trickle down to and have a lot more meaningful and impactful resolutions at the local level or the community level. Number two, working from home, from early on in the pandemic has really had a number of restrictions, but this has allowed me to really connect with a number of colleagues or friends who I might have stopped interacting with. And as mentioned during the introductions, this is what eventually led me to kind of co-found our public health communication and knowledge translation organization. So, using this time that we have now outside of work, trying to kind of hone in on your interests and your passions and really nurture those. And lastly, I think moving to virtual work has made it easier for me, at least, to reach individuals. And when I'm looking for career advice and career development, I find that people have been more willing to speak to me and have Zoom calls to chat and have information interviews now that everything has gone online. And this has been very beneficial in whether I'm looking for future opportunities or if I'm just interested in a new field. Feel like because everyone is kind of stuck on the Zoom world, and people are more and more used to kind of this process. So yeah, it's kind of just my input, and I guess my experiences that I've been kind of feeling over the last year or so since graduating as a student. Like the other panelists, if anyone does have any follow-up questions, maybe regarding what I do in my daily life or like professional life, etc., be sharing my contact and we can discuss offline.
Perfect. Thank you so much. So we do have a few questions coming in for you now. And as a reminder, again, please feel free to keep typing your questions in for William. The first question we have for you is, it was interesting hearing you talk about the transition from studying public health to working in public health, how different the latter is from the former. Have you had any experiences with mentors, and has that been helpful during the pandemic?
Yeah, so that's a wonderful question. And I think mentorship is such a key part, at least for me, in my transition from being a student to the professional world. Let's just take, for example, my practicum. And when I was in my practicum, my supervisor was very supportive of not only kind of helping him and with his role, but also fostering opportunities and finding opportunities for me to kind of develop as a professional. And I think I was definitely lucky to have landed on such a wonderful supervisor, and kind of I think the difficulty there is, how do you find a mentor, and what kind of mentor is appropriate. And something that someone once told me in the past is that a good mentor is someone who doesn't tell you what to do, because that's essentially a coach, right? A mentor is someone who kind of is able to walk you through the process and help you think and kind of come to a conclusion that's appropriate for yourself, and that kind of makes sense for your circumstance. So I think, yes, that's kind of something that I try to do as well when I'm helping out, or if individuals, whether students or young professionals, are kind of reaching out to me or who are interested in public health. I try my best not to be prescriptive, and I try not to tell them this is what you should do, but more kind of try to get into their shoes and understand where they're at, where they're trying to go, and maybe walk them through to help them come to a conclusion that's best for them.
That's awesome. And that's a great comparison with the coach and mentor. Thank you. Next question we have a couple attendees who are excited to hear about some of your international response work that you're doing. What are some key lessons you've learned from how other countries have responded to mass disruptions such as the pandemic?
Yeah, I think it's honestly, it's a very interesting question. And I think being in the field of public health, we all understand the importance of local context, right? And I think it's in the situation with the current pandemic, we've really seen how public health measures, often prescribed at a global level or even a national level might not work in specific communities. And I think it's really important that looking at these communities to implement measures and programs or things that really work for the community, understanding their needs, understanding their capacity. Because let's say a lot of our work is, a lot of my work is kind of Canada's engagement in the region, like the region of the Americas. And if we have certain communities, let's say like remote communities, whether in Canada or abroad, who have challenges and barriers even just to accessing basic essential healthcare, we can't just be prescribing very high level health measures when we should be focusing on how do we ensure that testing is available. How do we ensure that things like hand washing, sanitation, these measures are being done before looking at other things. I think as well, it's interesting that at the international level, the pandemic has really kind of thrown a curveball and really heightened the level of political and politicization that is taking place. For example, a lot of our work does take place in the regional office of the WHO, and this is a very strictly technical forum, which is meant for countries and member states to come discuss specific health issues from a technical lens. But with the onset of the pandemic and with the virtual platform, it has caused, I would say, definitely taken a more of a political turn, and unsure of how long the pandemic will kind of be affecting and how long virtual meetings will take place. Maybe this is definitely an area for us to be wary of and cautious going forward.
Okay, and we've got some interest actually more with your role. Can you share a bit about the day-to-day role of a policy analyst?
Okay, that's a very tricky question, because I think a policy analyst, it really depends in what kind of field you are in. And I guess from my perspective, because I work, as I mentioned earlier, in global health policy and governance. So it's a lot of the time it's responding to day-to-day things like responding to emails, because we do manage Canada's engagement with the Pan American Health Organization. It's a lot of kind of interacting with the organization. If they have requests for survey responses, they'll send it in to us, and then we'll kind of track it out and then distribute it across the government to necessary and relevant stakeholders. As well, I guess the more the analysis side of things is oftentimes, so the Pan American Health Organization has what are called governing body meetings, which are kind of the high-level strategic planning meetings with all the member states in the region. And leading up to those meetings, we would prepare a lot of the discussions, the position statements for Canada, and the interventions that are delivered at the plenary sessions. And this would include, going through the documents, kind of being very critical of the documents that the organization provides, and seeing how, from a Canadian perspective, the document might resonate with us. So things that are very important for the government include, our feminist international assistance policy, and how do we kind of emphasize key areas that are important for the Canadian government that might have been missed in the initial drafting. And then oftentimes this kind of gets into the negotiation side with other member states who might have differing views or priorities. So I guess that's where our other colleagues from across the government, whether it's global affairs or other departments, kind of come in and assist us with the more political side. But yeah, I can't really say what's expected on a day-to-day basis, because in international health, things do change very quickly and very rapidly. So it's a never dull moment, I guess.
Awesome.
Yeah.
And so continuing a little bit with your role, especially as a recent grad, the question we have for you is, what are your thoughts on the value of networking with established professionals versus peer networking with other young people, specifically for recent public health grads during virtual times?
I think there's definitely value in both. So I personally, I've continued to network with fellow peers, people who are, I guess I would say, in a similar stage that I'm currently in my career. mostly just to kind of broaden my network and get to connect with like-minded individuals who might have interests similar to me, professionally or personally. I think this is a very valuable. Yes, I find it very valuable because it allows, if someone has an interesting research proposal or would like to kind of write an opinion piece in some sort of publication, this kind of allows us to almost form like a small working group to kind of work on something that we might all have an interest in. And this is kind of where my when I co-founded the organization Public Health Insight, that's where that was mostly the catalyst of it, because it was me starting it with 4 other members of my Masters of Public Health cohort who we sometimes would hang out, and every time we hung out, the discussion would always end up being about some public health topic, and we're like, okay, we're just a bunch of public health geeks. Why not like actually turn this into something meaningful, right? So there's definitely value in that. I think, and obviously I would say there's value in connecting with more established professionals, because for me, even now, I would reach out to people in areas that I might have interest in working in, or just people who I see are working very cool roles. Number one, just to get an understanding of maybe what they do, if this is a possible pivot later on in my career, but also kind of just have these established connections. I do, for example, with our Public Health Insights, one of our products is we do produce a podcast, and I think having these established connections with well-established professionals allow me to have another network to kind of tap into if we are looking to have guests, kind of bring in more professional, more established perspectives or comments on what they might have. Yeah.
Awesome. Yeah, podcasts are definitely becoming increasingly popular. So on that note, if you have more questions for William, please feel free to put them into the chat. We've got about a couple more minutes until the end. And of course, all of this, the recorded webinar will be made available to you on the HPO website. I'm just going to share my screen before we get to the end. Thank you so much, William, for that talk. So as we come to an end of our first webinar, I'd like to thank our 3 panelists, Marty, Melanie, and William, for sharing your unique perspectives, your strategies for getting through this time, as well as taking the time to be here with us today to kickstart this 4-part webinar series. So you just had the opportunity to participate in our kickoff event. Next Thursday, same time, 12 o'clock, our next topic will be the shadow pandemic, and you can register for all of the webinar series for the month of November on the Health Promotion website. Also, if you are not already, please follow Health Promotion Ontario on Facebook, and you'll get all of the updates, including these webinars, upcoming future events, as well as getting involved. And on that note, I'd like to thank all of you for being here today. Thank you again to the panelists, and thank you to our planning committee, and hope you all have a wonderful rest of your day, and hope to see you again next week. Thank you so much.